Our demand to have an answer begins in these bags. Hundreds of samples from suspected COVID-19 patients ready to be tested at Wales' largest microbiology centre.
We process the samples, check the patient demographics, we look at the clinical information, and then we decide what machines that we're going to test them on, depending on how soon we need that test result.
There are now more than 50 staff here, doubling since before the pandemic. They work 7 days a week, 24 hours a day. COVID-19 means they have to.
So at the moment, they are snapping off the throat swabs into a solution so we can perform the test.
As well as more people, there's new machinery too. Jonathan Evans is the operational manager here at University Hospital. Back in March, they processed 50 samples a day. Now, they can do almost 3,000.
We're bringing in new staff on a daily basis, training them up, bringing them onto the front line to support the virology staff who've been doing this since February. We're very fortunate that our government is fully supportive of what we're doing here. It is challenging, but it's what we do, it's what we enjoy doing, and thankfully there's a lot of people who want to support the COVID response within Wales.
As a Pillar 1 testing lab, they focus on patients in hospital, potential outbreaks and NHS staff. So this is the final part of the process. If a sample is positive for COVID-19, a steep red and blue line will appear on the screen. But with the testing regimes across the 4 nations facing continued scrutiny and at times criticism, public health officials admit they too have concerns about how they respond to demands for even more tests.
As the numbers go up and if the testing requirement goes up through the roof, we're going to hit those same problems that we had back in March and April. If those supply chains aren't maintained, that we need to get those tests through the system.
As we filmed, more samples that required testing arrived. With the infection rate increasing, that's not set to stop. Warren Nettleford, 5 News.